Hi.
Hello there, how are you? I'm Dr. Shariful Halim, and today I will show you how to see the thyroid gland. So how to examine the thyroid gland and associated features of hypo and hyperthyroidism. So let's start right off. Okay. Assalamu alaikum. কেমন আছেন আপনি? আপনার নামটা কি ছিল? Very good. আমি ডক্টর শরীফুল হালিম। আমি আপনাকে একটু পরীক্ষা করব। আপনার গলায় থাইরয়েডটা পরীক্ষা করব। Okay? So we have introduced ourselves and asked for the consent. Okay. Next, we have to actually make the patient sit, and we have to examine the thyroid gland in a sitting position. That's very important. আপনি একটু কষ্ট করে বসতে পারবেন? Okay, please come here. So when I ask the patient to sit, and now let me explain that what are we going to see. So first of all, we are going to examine the patient from front. Then we are going to go in the back. Then again we will come in the front. Okay, and complete the examination. Okay, so let's start from front. So from front, we have to ask the patient for protrusion of tongue and deglutition, and then we'll look for temperature, tenderness, and tracheal position. And when we go back, we'll actually palpate and confirm that the findings that we've gotten from asking the patient to protrude his tongue and deglutate. We'll confirm the findings, and also we'll look for temperature, tenderness again, and also we'll actually see the consistency, we'll see the surface, we'll actually delineate the margin, and we'll see for fixity. So fixity with overlying structure and fixity with underlying muscles like sternocleidomastoid muscles. And then we'll, after doing those examinations, we'll also have to do some spatial examinations. And the spatial examinations are various sign, which is actually pressing on the carotid artery and seeing if the carotid pulsation is present or not. So in case of a patient of thyroid cancer, the various sign will be positive, which is actually a decreased or absent carotid artery pulsation. And also we'll have to do culture test. We'll press the patient's mass or tumor or serous swelling over the trachea, and we'll see for stridor or any respiratory distress, if it's present or not. And one thing very important, when you do that things, we'll actually also examine the lymph nodes. Okay, so the lymph nodes may be enlarged in case of thyroid cancer, like papillary cancer. So the lymph nodes may be enlarged due to metastasis from the thyroid tumor. Okay, so after seeing those from back, we'll come again in the front. Okay, and we'll see for lead retraction, lead leg, Mobius sign, and we'll actually examine the patient's hand, and also examine the pulse, and examine the patient's legs for pretibial myxedema, and also look for delayed relaxation of the ankle joint. So I think this is a big description. Let's start off and go slowly. আপনি যেটা করবেন, আপনি আমি যা করি তা করবেন, ঢোক গিলবেন, ঢোক গিলেন, ভেরি গুড, জিহ্বাটা বের করেন, বের করে জিহ্বাটা, ঠিক আছে, ভেরি গুড। আপনার এখানে কোনো ব্যথা আছে? কোনো ব্যথা নাই, আমি আপনার এখানে ধরবো, ব্যথা লাগলে আমাকে বলবেন, হ্যাঁ? So we'll actually first see for temperature, and to look for temperature, the best thing to do is first see the normal temperature of the patient and compare it with the abnormal, okay, in the central line, and we are actually seeing the temperature with the back of the hand to have a good feeling. Next we see for tenderness. So when we see tenderness, we'll actually put our fingers over the thyroid, and then we will actually see at the patient's face if there is any pain. So this is the tenderness. Next, we have to see the position of the trachea. So if the trachea is deviated to any side or not. Okay, so we are seeing the position of the trachea. Okay, trachea is central in this patient. Now we have to go in the back side of the patient. So we are going back. So then again we have to confirm our findings. We have to, আপনি আবার ঢোক গেলেন তো, জিহ্বাটা আবার বের করেন তো, জিহ্বাটা বের করেন তো বাবা, ভেরি গুড, ওকে, আবার মুখ বন্ধ করে ফেলেন। Now we are seeing the surface, the consistency, okay, the margins, okay, surface consistency and margins, most important. And then we can actually measure the thyroid gland. So I'm not showing you how to measure. It just measure all the directions. So measure vertically and also measure horizontally. So measure actually the size of the thyroid gland if it's enlarged. Okay, so it's also an important point which should be done in the palpation. So as we don't have any tumor or thyroid swelling here, actually I'm not showing you that. I'm showing the other parts. So we are seeing the surface, consistency, margins, and then we'll look for fixation with the overlying skin and fixation with the underlying muscles. So the common muscles that can be fixated in thyroid tumor or thyroid cancer is sternocleidomastoid. So actually first we have to taut the muscles and then we look for fixation. আপনি আপনার মাথা দিয়ে আমার হাতের মধ্যে চাপ দেন, এভাবে না, আমার দিকে তাকান, এরকম করে চাপ দেন. Very good. So we have to move the mass, and again এদিকে চাপ দেন. We have to move the mass. Okay. So those are the most common things that we see. Next we'll see cervical lymph nodes, and we'll also do some special tests such as examination of the carotid pulse to look for Berry's sign. So we'll see Berry's sign here by examining the carotid pulse in left side. Then we'll examine the carotid pulse in the right side and look for if the carotid pulse is present or absent or diminished. And now we'll ask the patient, we'll press the tumor or the swelling over the trachea. So we'll press the swelling over the trachea and actually try to look for any stridor or not, and we actually see if the patient developed any respiratory distress. Okay, so this is Cotter test. So those are the basic tests, and always remember that when you examine the thyroid gland, don't forget to examine the lymph nodes. So I'm not examining the lymph nodes. I'm just you have to examine all the cervical lymph nodes. Then you have to come forward, and here we have to actually start seeing some eye signs. So please come here. So first we see if the upper eyelid covers the upper margin of the cornea or not. So we can actually see the upper part of the sclera. If we can see the upper part of the sclera, it will dictate that this patient has lid retraction. Then we'll see for lid lag. And to do that, we have to ask the patient to move his eyes following my finger. Okay, so let's do this. আপনি আমার আঙ্গুলের দিকে তাকায় আঙ্গুলটা যেদিকে যাবে আপনি সেদিকে তাকাবেন. ওকে, মাথা নাড়াবেন না, হ্যাঁ, মাথা নাড়াবেন. Very good, very good. So this is lid lags. In case of lid lag, the lids will be slow. Next we have to see Mobius sign, and to look for Mobius sign we have to actually fix the patient's eye to a specific object, and then we tell the patient to look in front of my finger. Okay, আপনি একটু ওই যে ওখানে দেখা যাচ্ছে একটা লাইটটার দিকে তাকায় থাকেন, তো আপনি তাকায় থাকবেন এখানে, হ্যাঁ, একদম ওখানে তাকায় থাকেন. তারপর আপনার চোখের সামনে যখন আমি আঙুল আনবো একটা, আপনি তারপর আঙুলের দিকে তাকাবেন. বুঝতে পারছেন? ভেরি গুড. তাকায় থাকেন ওখানে, এখন তাকান এখানে. Very good. So there is medial convergence of the eyes. So this is not a positive Mobius sign. In case of Mobius sign, medial convergence won't occur. So those are the most common features in the eye, you see. And then we will see the patient's hands. So please, I'm here. আপনি এরকম করেন তো. So here we are actually looking for a fine tremor. So if there is any fine movement like this, you can see this is the fine movement of the fine tremor. I don't have hypothyroidism. Okay. We can also augment this process by putting a paper on the patient's hand, and I can also examine in the same level. Then we'll actually handshake again with the patient, and not for social purpose or medical purpose. And this handshake is actually we're assessing if the patient's hands are dry or wet. So if the patient's hands are dry and also there is coldness, it will be telling us that this patient may have hypothyroidism. If the patient's hands are warm and sweaty, it's a feature of hyperthyroidism. Next we will look for pulse, especially the rhythm and rate. So the patient of hyperthyroidism can have atrial fibrillation, and a typical atrial fibrillation pulse is there will be tachycardia and an irregular rhythm. Next we have to see the patient's legs, especially the front of the legs, to look for Pretibial myxedema, which is not present in myxedema, which is present in thyrotoxicosis or hyperthyroidism. Okay, আপনি একটু আপনার পাগুলো আমার দিকে দেখান তো, আমাকে পাগুলো দেখান। আপনার এই জামাটা একটু উপরে তুলেন তো, পাজামাটা। Very good. এটা একটু উপরে তুলেন। So here we'll look at the patient's shin. So we'll see for any erythema or plaque formation over the shin, which is suggestive of pretibial myxedema, which is present in thyrotoxicosis. Next, we'll conclude our examination by seeing the ankle jerk. In case of hypothyroidism, the patient's ankle jerk may be delayedly relaxed. So the relaxation phase will be delayed. So let us see the patient's ankle jerk. আপনি একটু kneel down করে বসেন তো, kneel down করে বসেন। Very good. This patient is very smart. Okay. Now we are seeing the patient's ankle jerk. Okay, please give me some space. আপনি পাটা একদম নরম করে রাখেন বাবা, একদম নরম, নরম, একদম নরম, হ্যাঁ, একদম নরম, এই জায়গাটা একদম নরম, হ্যাঁ। নরম 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 করেন, নরম করেন, ছেড়ে দেন, আপনার পাটা ছেড়ে দেন আমার উপর, হ্যাঁ, একদম ছেড়ে দেন, কিছু করেন না, আপনি ভুলে যান এটার কথা, হ্যাঁ, ভুলে যান এটার কথা, শক্ত করেন না, হ্যাঁ, নরম নরম, প্লিজ। আপনি আমার দিকে তাকান। So we can't elicit the patient's jerk. So to elicit in case of difficult patients, we have to do Zendrastic maneuver. So to do the Zendrastic maneuver, let's ask the patient. আপনি এরকম করেন, এরকম করেন, হ্যাঁ। আমি যখন 1 2 3 বলবো, তখন আপনি এখানে জোরে চাপ দিবেন, এভাবে করেন, এরকম করবেন। 1 2 3 বললে এটা করবেন, ওকে? স্মার্ট, ভেরি গুড। 1 2 3, 1 2 3, ওকে, 1 2 3, চাপ দেন জোরে, ওকে, ভেরি গুড। So the patient's ankle jerk, there is one phase where the ankle actually moves and then it comes back. Okay, so when the ankle comes back, this phase is called the relaxation phase, and this phase will be prolonged in case of a hypothyroidism patient. So that's all from me about thyroid disorder or examination of thyroid gland, and thanks for watching the video, and thanks to our patient. Thank you.